Alice's.
Or,
these are
yeah,
peons?
just different. Those are
For those
less
cokers.
dramatic than the Doyen,
Cokers.
but same
Two
thing.
straight cokers, two ounces, and four curved cows.
No, I just used it because I couldn't get my scissors out because my stringer was still.
Yeah.
Curved
Use
mayos,
this.
curved mayos, straight mayos.
Well, you guys go ahead and take your stringer off.
Yeah.
Veggies.
We're
'Cause
trying to
if you
speed
guys,
things
it's
up.
just gonna screw you guys up if you don't.
Yeah,
take
don't
the
do
stick
that
off.
way.
Is that a set?
What's that?
Yeah,
What's the
no.
long
Huh?
knife handle number?
No, that's how I do it.
Oh,
It works.
yeah.
It don't matter what you count with,
Is it a 5, 3?
but we need you guys to have
That's
the
a-
suture
yeah, that's
system
a
when
three.
you
No,
It's
it's not
just-
a 3. That's a 3.
You know what I'm
No,
saying?
they are. It's just bigger size.
It's a 3, but it's extra long.
Yeah. Okay, so it's a
Okay,
long.
yes.
Joel was here.
We'll
We
make
just
it,
did
you
it.
guys make it, put it in your group chat. Okay, you're recording anyways. Take the stringer off when you count.
Yeah,
We're
go
just
ahead and
trying to
take the
speed things
stringer
up
off,
so
yeah.
that.
Okay.
Okay.
Okay, all right, let's wait.
Okay.
Oh. Okay, we got to move.
Okay, the supplies that you guys will need is GIA stapler with 2 loads, probably a skin stapler on standby, and a TA stapler. I believe you guys already gone through this in general surgery.
We just covered it.
Okay, perfect. You guys want to take a picture of this? These are the whole items. So same telephone. Everything's the same. Yep. This is the standard X lab.
Here,
A lot of
let me open
treatment
them.
has been
Yeah.
used for to square
Get
off.
these on or off?
You can
So it's all these right here.
These are the staples that we load into it.
Thank you.
Okay.
Okay.
All right, you guys, come check this out.
Okay. We're gonna open this as a whole class. So when you guys are unfolding, keep in mind this part is not sterile, right?
Okay.
So when you take a half step or a step, when you take it back, make sure it's still up in this area, in this square. Okay? When you flip it, T does it this way, and I do it another way. There's nothing wrong with
So
either
watch,
way.
Sherry will do it her way, and then we'll switch, and I'll do it her
I do
way
this.
up top.
Okay?
Okay.
Sherry
Same.
catches it right here.
Yep, I like to do this, and I do that.
It
It's
still
the
touches
same.
your hand, okay?
Okay, so everyone, this is the whole class, was doing this weird thing, trying to get that side. But just, okay, note to self, there's nothing wrong with, as long as you cuff it. All right, this procedure, scrub tech will be the one putting the cores up. Okay, we're gonna wait for you. The only thing the surgeon will take is the line handle. It's up to you guys to do the cord management. Okay, and watch how he does it. After he uses the cow can, somebody take a picture of how it's placed. He normally extends it to a point where it's just enough length for us to operate in this field, okay? I don't need all the extra loopy like this, we don't do that, okay? It's just gonna create chaos because later
Your
on
side
I
or my
might
side?
add for, your side's fine. I might add in like ligature device, other, heating, cutting devices. Just wanna make sure this is nice and clear. Okay, we still line the incision. We line with 2 laps, okay? We're doing a
Yeah,
midline,
midline.
that's why we're doing this way. So not a hernia, not a phanastile, we're doing a midline,
Sharp thumb.
okay? Okay, great. We did timeout, blah, blah, blah. Let's get started. Incision, not done. Buzz, 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 everything's the same, we're going in the same layers, buzz, buzz, buzz. Okay. Oh. Okay, I'll take this back. I'll take
Balfour?
Balfour, yep. 2 wet labs, please. Okay. This is to protect the abdominal wall or other organs or adhesions or whatever you find in there.
So they need to be wet.
Exactly.
So to keep
Yep.
them
So
moist.
moist. Exactly. Because we're touching like connective tissue, right? Okay. So notice how the way that he handed this to me. Okay. So we take it down, set it down, then you'll help the surgeon. And this is how we pull it apart. This blade should cover on the laps.
Okay.
Okay.
And
Yep.
also, if these laps aren't protecting the patient's skin, if we touch this with the Bovie, it will burn the patient.
Yeah, so if I accidentally was bowing and bleh, then
And we
Patient's
didn't have
gonna
these
burn
laps, we're gonna
all
burn
the
the
way.
patient.
because this is metal.
Okay.
Okay, and when you hand the bowel cord, you wanna make sure that the wing nut is down by the pelvis, because that's where the bladder is, and, I'll ask for a bladder blade.
Okay,
Would
I'll
you
take
like
the
a
biggest
bladder
one. Okay. Then this goes in the middle. Then you push down as retracting, maybe. Okay, like that, and then you can
Okay,
lock
so
it up. It protects bowel, lower pelvic, organs. Could be bowel sometimes too. Okay, you guys, somebody want to take a picture of this setup right here? Alrighty. Okay. All right. We will keep going. Oh, you don't have to. Oh, where's the bowel? Oh, this is
yes,
bowel.
that's it.
Okay, that's fine. Okay. So yeah. So notice, like sometimes surgeons can change size. I can be a lefty today. Okay. Those are the things I'm gonna throw in there the second test or the final exam.
That you're a lefty and.
Yeah, I'm not ready. Yeah. Sometimes I can't see on this end. If I'm dissecting this way, I have to use left hand. Okay. All right. So now we're gonna run the bowel. Same thing. Like I need something wet. So wet or dry.
Yeah.
Okay. So we're running the bowel. Okay. A lot of times we'll pull the entire bowel. We run the whole bowel. Okay. Sometimes it's just a hand running too, or we can use a back cock to run the bowel too. Okay. Or sponge stick. So sponge stick, we can use it for blunt
Oh,
dissection.
good. I need a tie towel too
Okay.
after this.
Okay. All right, I'm running the bowel. I think I found the specimen or the pathology. Here's that.
I'm gonna go
Okay.
get, ties.
So now, just imagine, guys, we're lifting this up, all the bowel up. What do we see? What's connected?
Tissue, the omentum.
Yeah. Oh no. Yeah. Omentum. Oh no. That's sorry.
Mesentery.
No. Mesentery. Sorry. Mesentery. So we're lifting this up so you can see the little see-through, clear kind of tissue here. Okay. That's where it supplies vasculature to the bowel.
Okay,
Okay.
all those little,
Veins, arteries, all
arteries
that.
stuff that's giving,
Blood.
blood supply to the bowel, and we have to, close off all those blood supply to the section of bowel that we're taking out.
Yeah. Otherwise, we're gonna go like crazy. Bleed like crazy.
Okay, so
Okay.
these are your ties. You guys would pop these when you pop your suture, okay? Now, two ways you guys can do this. Either way is fine with me. One, you can tear your pack and you have them like this, and you can stick them in your Mayo stand like that. I don't like doing that because it crinkles the thing and then they're
Same.
hard to get out
I am
and
the
all
same
that.
way.
So what I'll do is take a towel, put it on this end of my Mayo, open it up, just the one right there. Oh, shit, let me do it this way. Take these out. And put them in my towel right there. That way I can just pull
It's
them
easy
straight out.
access that doesn't get stuck.
Okay?
Okay.
Okay? You can do it both ways, whichever you like.
Okay,
Okay.
now, whenever we're ligating a vessel, rule of thumb is clamp, clamp, cut, tie. We have to clamp both sides, cut it, then tie it, okay? When we're doing vessels,
I'll take another
when we're doing vessels, we only use curved mets for vessels, okay?
They're delicate, right?
Oops, my bad.
Okay, alright, hope you hold that. So then you would tie, right? So, okay. Flash?
Oh, it'll,
So if that happens, then that means the blood is shooting everywhere.
yeah. So you gotta do it real
Does
quick.
that make sense? So you will do,
I got that much to get on.
yeah. Okay, alright, flash. Okay, flash just meaning that, we have occluded
You're
it.
gonna open it up and see if it's still bleeding. Okay?
Okay.
Open what up the vent?
The vessels,
Okay.
Yeah.
Oh.
Oh, we're gonna open up the cryo.
the cryo.
Okay.
Okay. Alrighty, we are done with the mesentery.
Alright.
Pass the mayo to surgeon.
The Mayo, yeah, the Mayo's
To
to
cut sutures,
cut
you use
sutures.
it.
Sometimes we cut, sometimes they
Yeah,
cut. It depends.
Yeah, that's more of an anticipation. Okay, alright, so now we cut off the blood supply. Now we're gonna do scutters. So I can ask for one straight, one curve, or two curve, two straight. And then this is the Coker Allen. Okay,
How would you like to reset?
I'll take a GIA
Can I get
with
the GI
two
stapler
loads,
with two loads, please? So it's gonna be that one, so you're gonna open that box up. Okay, you're gonna bring the stapler over to me, open it up,
Just like a peel pack item. There you go.
okay? So just come here, just don't go over my table, I'll come to you. Okay, and then I need those other two loads. So once I get this, to open this, push this button right here, it'll pop that open, then you can just pull it
And
apart.
just pop it into the.
So yeah, just toss it into my pan or on the table, either one.
There you go.
It'll come open like this. Now, this is the staple part right here. Don't take this yellow piece off. This is a safety. There's a blade underneath here that cuts. So if this is not on here, it exposes the blade. So leave these on here, okay? You can change these out, and I'm gonna show you guys how in a minute, without taking this yellow strip off, okay? So, we'll take the yellow strip off, not for real, that's the safety. Put it back like this, and then we're gonna hand it to the doctor like that.
Okay. I'm gonna clamp the bowel. Okay, it's done.
Okay, this is a dirty, clean case, or dirty case, depending, but, I'm gonna keep a dirty towel for all the stuff that's been in the bowel or in contact with the inside of the bowel on here. And then I usually put a towel here too, so I can put all my dirty instruments, because we don't wanna mix those, okay? Our dirty instruments and our clean instruments. Take this out. You're gonna grab this, and you use a towel or something, because this could be poopy or whatever, and you don't wanna get it all in your gloves. You're just gonna lift from the back, and it'll pull itself out, okay? Set it down, grab our reload.
Oh, the yellow one, I think, so in there.
Oh, yes.
You wanna put the safety,
Yeah.
be careful, because there's actually a real blade in there, guys.
Yeah.
Here, I'll just put that. Go ahead.
So when you go to put this on, you just go right from the tip and push down from the back,
Go ahead, man.
okay? Take it out, lift up from the back, pull it out. There's these little things right here on the front.
It sits into the little groove right
Yep,
there.
and it'll sit in, all you gotta do is put it like
Tip
that,
down and push it.
and then push from the back,
Tip first and back.
okay? This blade is out.
Yeah, we gotta, just be careful, guys.
All right, actually, I'll use this one. Can you put that one back over there, please? Thank you.
So the tape is
It's to hold the safety on.
Yeah, it's just
so
to hold
that
the
the
safety.
safety doesn't come off.
So during the procedure, are we gonna leave it?
Yes,
leave
this,
it on.
this will stay just like it
Just
is.
like this.
All you
In real
guys-
life, you're gonna take it off?
Yes.
Okay.
Yeah.
In when
Yeah,
you go
just
out
say I
there,
would take
yeah,
out the
in real
safety,
life,
yeah.
Okay.
because we just wanna be careful and then we can overuse it, like reuse it too. Okay, so I'm cutting the other side, transecting the other side of the bowel. There's that.
Is this the specimen?
Yeah, oh, not yet, let's, oh yeah, it
the
is,
second one.
sorry, it is. Okay, just kidding.
Okay, I'll set that right there, or you're doing that, reload.
So do
And
you
when
want?
you guys reload, also, this part, you wanna take a Raytech and wipe this off over your dirty towel, cause that's gonna get all the leftover staples out of this, so we won't get them in the patient, okay?
Okay.
So we're gonna wipe those off, and then this can go in the kick bucket.
Okay, specimen,
Alright, would you like it called?
small
How would you
bowel,
like a scent?
permanent at the end.
Alright, now, when we go to give the stapler back, we're gonna get, well, it's not time for that yet.
And I will explain this portion of the bowel resection in the classroom so I can draw a picture. It's kind of hard to explain right now with this. Yeah. Okay. So I'm cutting one edge of the bowel, pretty much two sides, because we're putting two back together. So there's that, the 30.
So these are my dirty scissors. I'm gonna just put them on here because I'll probably might use them again. So I'm just gonna leave them on my dirty thing. Okay. Now we reloaded this. When we give it back, we're gonna give it to the doc in 2 pieces.
Okay, have you hold that, 2 pieces. We're gonna put it together. Okay, that's done.
Dirty, been inside the bowel.
Yep. And then now that we connected the bowel together,
How you
we're
want to
gonna-
finish?
let's just use. I'll use that curved mayo again to cut it off.
Alright.
Yeah. So this is dirty. Then I would cut the tip off. Yep. And then
Need a TA.
yep. Oh, we missed.
Yeah, TA first. So I need a
okay,
TA stapler?
Sorry, TA first. Sorry. Okay,
That's the other stapler,
rewind.
yep.
We're gonna get
Nope,
back.
that's the skin stapler, the other one, that one right
Yep.
there, yeah.
We need to do the TA and then we'll cut.
So what we just did was we cut the bowel in half. Now we put it side by side. We cut the
together.
tip off,
Now we gotta finish the the connection on top.
and then the two pieces of the GIA go down inside the bowel, and then it cuts on the inside. But we'll show you guys more of that later.
Yeah. Okay.
And this, the way they're gonna use it. See how I passed it?
Yep.
The
and
way they're
this
gonna use
locks, and we'll go into details once.
Yeah.
This is worry about the setup first. So it's done. Here you go. And then now we will cut the top part off.
Are we saying sharp with the staplers?
No.
Now the tip will actually come off after we tee it off. Normally, these four has a piece of bowel strip on top because we just
That's
closed
the
the
part
loop
we
on
cut.
top. And this part, sometimes this could be the final margin or it could be just trash. Okay, so in this scenario, this is trash. So go ahead and this is garbage. There you go. Okay. All right. So now we're done with the bowel resecting. I'll take the irrigation.
Big or small?
Big please.
Alright.
And notice how T's holding this. Okay. And then, as a tech, you'll need to let the surgeon know this is warm saline. Why do we have to use warm saline in the body
Keep the
cavity?
body temperature.
And
Yeah.
what'll happen if we put cold water?
Lower the
Yes.
Exactly. Perfect. All right. Pouring. Okay. Done.
Alrighty, how would you like to close?
We'll do the fascia and then skin stapler.
Alright.
And here's all your stuff back. Okay. Thank you. Pick up and
Bondage.
two laps. Okay.
Alright, give me a
Great.
second to straighten this up
Okay,
real
so
quick.
surgeon sewing, and then can someone pass me the count sheets, please? Now we're gonna do our cavity closing count. We're gonna do the whole thing. When we're counting this step, the closing count, the circulator will call out the names.
Okay, notice how I just did it the first time? This time the circulator is going
Alright,
to
you
call
ready?
it out and I'll count it.
Laps.
Alright, laps. 1, 2 on the field. 3, 4, 5. Circulator.
1, 2, 3, 4, 5, 10.
Alright.
Okay. Ratex.
1. Well, I guess he's standing over there. 2,
Yeah.
3, 4, 5, 6, 7, 8, 9.
10. Okay. Blades.
1, 2.
Hypo.
1, 2.
Needles.
0.
Bobby.
1 bulb and scratch.
Scratch. Okay. Pen and cap.
1, 2, 3.
All right. You ready for major?
I'm ready.
Okay. Sponge stick.
1, 2.
Coker.
1, 2, 3, 4 in the basin.
Okay. Right angle.
1, 2, 3, 4.
Bab.
1, 2, 3, 4.
Alice.
1, 2 in the basin.
Peon.
3, 4. Peons. 1, 2, 3, 4, 5, 6.
Cryo.
Cryos. 1 up. 2, 3, 4, 5, 6, 7, 8, 9. Yeah. Oh. Recount. 1, 2 up. 1, 2, 3 up. 4, 5, 6, 7, 8, 9, 10, 11, 12.
Okay. And cryo. We did that. Okay. Needle holder.
Needle holders. 1 up. 2, 3, 4, 5, 6.
Okay. Scissors.
Scissors. 1 up. 2 in hand. 3, 4, 5 in special. 5 right there.
Okay. Chocolate.
Top clamps. 1 up. 2, 3, 4.
Knife handle.
1, 2, 3.
Tonsil suction.
1 tonsil.
Pull.
1 pull sheath.
Okay. All the pickups together.
1 on the field. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Okay. Bowel set. Scissors.
Scissors. 1, 2.
Needle driver.
1, 2.
Coker Allen.
1.
Scutters.
Just like
Yep.
1, 2 in there.
Yep, Scudder, or sorry, you did that, yeah, Scudders.
Scutters. 1, 2, 3, 4.
Alright, Alice,
1, 2,
Cryo,
1, 2, 3, 4.
and Talcott,
1, 2,
and Russian,
1,
okay. And Retractor Set, Goulet,
1, 2,
Weedy,
1, 2,
Ribbon,
1, 2, 3,
Army, Navy,
1, 2,
Rich,
1, 2, 3,
Deaver,
1, 2, 3,
Harrington,
1, 2, 3,
Balfour,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Gelpy,
1, 2.
okay? Counts correct?
Sounds correct.
Okay. Alright, so now that we count it, counts correct, let the doc know counts correct.
Sounds correct.
And then, so there's, I'll just put it right here. And then now, fascial stitch, we're done. We'll give you guys the sutures, but right now just worry about this part first. Fascial stitch, and then Tech can ask, how would you like to close the
How would you
skin?
like to close just
Well-
like the hernia?
Just like hernia. I'll do skin stapler, so go ahead and someone pop a skin stapler. And then,
It's that one right there. Nope. Other one. Yep.
yep,
That one.
just, you can just pop it
And
in.
it'll be
Yep.
in the package.
There you go, alright.
Still
Alright,
have a count to do.
yep, okay, but you're gonna help me staple.
All right.
Staples, guys. It is
So
in,
right here?
yeah,
This is where you want to line up in between those two axes. Okay. There's an arrow sometimes, and then sometimes there's just this little bump right here. Okay. You want to put that right in between your axes.
and stapling the skin is under our scope of practice.
So we-
Okay, so on the test, you guys will be stapling. So you approximate the skin together, go ahead, good,
Oh, we don't have staples in this one.
okay, but
I need
here,
to place this.
I
Do we
wanna,
have
I
one
wanna
in
show
there?
you
Yeah.
guys how to staple too.
Yeah.
We can toss that in the garbage.
So you guys counted 0 needles, but she was working.
Those are needles. No, what do you call it? She didn't have an actual needle. We only count what we actually have. I don't even pretend. You know what I'm saying? If I don't have it on my table, I'm not gonna count it.
Okay.
She didn't have a needle. She had ties.
Oh, was it?
Okay, go ahead.
Yeah, ties.
So right in the middle where the two layers are approximating. Go ahead.
Good.
Yep. One more.
Good.
Okay. All right. So it looks like that.
Sorry. Don't mean to get in your field. Thank
Good?
you.
Okay. So and now same thing.
Wet and dry.
Wet and
Gloves
dry.
off.
What kind of dressing you want, and then
Then your count. And
And
if you
then-
guys, if the doc says they want to count, I mean they want to close right now, then we go ahead and close. We can count back here. Even
Okay.
after if we were like in a hurry, like I want to get.
Let's say
stuff
I'm
out
done.
now.
You guys are doing your sale thing. So the doc will never throw away your countable items. I'm gonna put it back on your mayo, and then give you the rest, and you guys can do the final count over there.
So we count the instruments 3 times?
No, just once.
Okay.
We're doing a soft count. That's
From in the
it.
beginning, and then the closing count, and then the skin count, which is stapler or suture or whatever, that's skin layer. That's the final count.
Oh, that's the skin. Okay, so that's.
Yeah, so 3 counts. One in the beginning, one where you're closing the abdominal wall.
No, we don't use,
Yeah.
we'll have Raytex on the field for certain things sometimes, but we will not put a Raytex in the belt.
Yeah.
We
No.
will only
Yeah.
use these loops.
It's too
Yeah.
small,
It's
and
too-
sometimes
Yeah.
I ask because sometimes the surgeons do ask, they use that for blunt dissection.
Yeah, they will. Yep.
It's very soft, it's more gentle.
But if we know we're not gonna use them, I'll get rid of my Raytex.
Okay,
So you won't
alright.
even add it to your count?
If I have them at first,
Yeah.
or if,
Yeah.
yeah, or if I decide, hey, the doc's not gonna use Raytex, then if they come in my pack, I'm gonna get rid of them before I count.
Okay.
Yeah,
Yeah,
but in this
before I count.
procedure,
Yeah.
you guys are do it,
Yeah.
you're do both. Yeah,
So then you would just come back here and do your count the same way.
Yep.
Laps, 1, 2, 3, 4, 5, Raytex, all the way down, and then, counts correct.
Okay, alright, and then it's the same thing, dressing, clean up, blah, 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 asking circular, do you need help? So, it's actually the same exact setup procedure, except like more
The only
instruments
thing
to
is
it and the
the
count.
instruments.
Yeah, instrument
You know,
counting,
and then your
and then
on
the
hold
procedure.
stuff, right?
And then I'm gonna tell this group the same as I told the other group, you guys all did an amazing job in anticipation, okay?
Okay.
So on the test, like for this test, I would say, don't focus on the procedure part, cause you guys got that part down, and it changes, right? It just really depends on,
And what she's
Yeah.
saying is your steps.
Yeah.
There's too many steps for you to write out these
Mm,
steps.
yeah, no.
It's too many, past this, past
Yeah,
that,
yeah.
past that, it's too many. So get a basic idea of how the procedure goes.
Yeah.
Okay? And you guys can watch, you know, at home or on YouTube, whatever, see how the procedure goes. And then when you guys question each other, when you guys are doing this, when you guys get a little more comfortable at being surgeon, ask each other, what else could I use besides this?
Okay.
You know what I mean? What else could I use at this point in time besides this?
Yeah.
If I want a self-retaining retractor, I have a Balfour. We have other big retractors that we could use. It won't always necessarily be that one. We may have to ask for it. The doctor may get in and be like, hey, I can't use this. I need a Bookwalter.
Okay.
So don't get caught up in,
The procedure.
we're gonna use exactly this at this step, because it doesn't always, especially
No.
now.
Yeah.
It doesn't work like that. These procedures are too big to like pinpoint one instrument.
Yeah.
Because we got like we said before, the patient's anatomy, the patient's age, have they had surgery before, more adhesions,
And
that type
surgeon's
of stuff.
preference, or you know, things
Yeah,
like that. So
so-
like, don't focus. Like I was telling the other group, you guys did a great job, anticipation. But however, focus on the setup. I
Yes.
think that's where everyone fell
Yes,
through.
most
is
of
because
the-
of the setup part.
Yes.
So really focus on that. This part, just note that you'll be using those staplers.
Yeah. And
Pretty
if you
much.
don't know
And
something,
then the
it is
messenger.
okay to ask.
Yeah.
Okay, I'm not sure what's
Yeah.
next. Now, like I said, we're not gonna
Yeah.
let you just do the whole thing.
No.
Yeah.
But if you don't know what's next, ask.
Yeah. And I
No,
give
I'm
out
not
cues.
sure.
Like listen to the cues. Like what am I saying? Oh, I'm lifting the bowel up. Oh, I'm gonna
So
do
she's
what
gonna check
next?
the mesentery, so we need a cryo
Like,
so she can
I'm
clamp
putting two
that
bowels
side.
together. You probably
Alice's.
another Alice's, and then come to
So it's listening to the cues
Yeah,
and
it's just like
everything.
the same thing when we
Yeah.
say, oh, I found a spermatic
Oh, I
cord.
see
You
the
guys
cord.
got
That's-
That's what we're gonna
yeah.
use, right?
Mhm.
So,
All
and these
those
are the
keys.
things that you guys gonna hear and see when you guys do. Oh, I see jacket.
Let's go.
So any questions, concerns?
Um,
I would say everyone focus on setting up.
Yes.
That's the biggest thing that got everyone. And it's time. You have 15 minutes. You gotta get this down. So I was telling the other group, focusing on the steps, yes. Come up with a plan, yes. Start using telling your teammates or classmates to let you know when it's a 5-minute mark, when it's a 10-minute mark. At 5 minutes, all your supplies should be on the table. At 10 minutes, you should be counting. So give you hints to help you set up. To be
Okay.
faster.
So count as, wait, they count as part of the time.
Yes.
Everything, everything. Set up from the beginning at the same,
Same glove to glove.
exactly, glove to glove, set up, counting, studying your instruments, knowing your instruments really well. You don't wanna be looking, try to tell the difference between two instruments. Like, is this a Coker or is this an Allen? Is this a Babcock or is this a right angle?
So every time you pause,
no-
it's seconds off your
Yeah,
time. so-
know your instruments. I do wanna say, one of the scissors are really long, and we showed this, T was sitting in like this, we're okay with that, okay, so it doesn't overhang. One of the tables is bigger, and depending on what pan you get, one of them really hangs out, but one doesn't.
Yes.
So, just note to self, as long as you know the content, if you see it's longer, then put it on the side.
Oh, okay, so we can do that once we get out the stringer,
just
just
the
take it
scissors.
off
Just the
and put it to
scissors.
the side.
Yeah, just the
Okay.
long
Just
scissors.
the long
that's it.
scissors,
Okay.
nothing else, just the long scissors.
Okay.
So it's okay for the basket to hang off in the back a little bit?
No, it shouldn't. That, I was
shouldn't.
about to tell you guys, this
Yeah.
basket, this table, you would have to turn your basket sideways, but I don't even wanna get you guys into that yet, cause
Yeah,
it's
I
gonna
know.
screw you all up.
Yeah.
Yeah.
So just do it that way. If it hangs off the back a little bit, it's fine, but right now, just do it like this.
Focus.
Yeah.
Okay. Are you gonna show us how to put together the Balfour?
Yes.
Okay.
Okay,
Soon as we
yeah,
get
we're
done.
gonna, yep, we're done, so you
Alright.
guys,
So there's no fascia needle? No needle?
Yeah, well, you guys
We're gonna
have,
give
we
you
will
guys
have
the-
all of that.
yeah,
They
focus,
skip
focus
it.
on
Setup.
setup and
Okay, okay,
counting
okay.
first, yeah.
I have a question, so you have
Your hair is sticking out.
the mullet,
Oh, shit.
you said you have the 2 layers, and depending on the anatomy, you're gonna state the difference, I can see the what was it called again? Mesentery, and what was the other one?
The
Omentum.
Omentum, and
Yeah,
so-
omentum is what you get in when you
Yeah.
first see, it's
Yeah.
covered, so
It
it
just covers
protects all your
everything. It's a curtain.
organs.
That weird film thing?
Well, that's the,
That's the,
mesentery.
that's the
The
mesentery.
omentum is really thick and fatty.
Mesentery is
like-
the
Yeah.
clear
Yeah.
thing that
Yeah.
holds all the organs together inside,
Okay.
right?
Mm-hmm.
Yeah.
I really couldn't do something right.
So if you lay the whole anatomy out on the table flat, then that's what you'll see.
Okay.
So,
You gotta hold up and turn
Yeah.
back, and then you pull the
yeah.
bowel.
For those of you I don't know if you guys gone to the body exhibition. If you ever go to that,
I want to
it's
go
really
to
cool.
that one.
You can see all that. Now they only have it in Vegas.
Because they're two
They had it
different
here
sets.
before a couple times.
We tried
Yeah,
to
just keep them,
before, and it was
yeah.
just
so
hard
you'll
to
know
get
where
in
It's
they
really
there.
count.
amazing to see all the
Keep them separate
oh,
so
yeah.
you can count.
pictures.
Okay.
All right,
Okay,
so
you guys
valve
for-
for 11 pieces to this valve for, okay? This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay? So basically everything that can come apart on this is counted.
Okay.
Okay? The way we put it together. Gonna have this. Next. That one goes on. Next. This one goes on. You wanna have this pointed towards the middle. It should look like 2 hips on the side. If it is this way, it is incorrect. Okay? Okay, once we get that on, close that. That way if it does slide, it won't come off. Okay? Once we get that on, now based on what weight you put for the patient is gonna determine what blades we're gonna start with. If we have a fluffier patient, we're gonna use the longer blades to start with. If we have a smaller person, we're gonna start with the short blades, okay? Now when we put these on, these will go on both sides, but if we put this on, the blades on, the same way as the wing nut, when we go to put the blades in, the wing nut's upside down, okay? So in order, if we need to change that, if you happen to do it, just take this off and switch it to the other side because they're interchangeable. You don't have to take it all the way apart, okay? These knobs right here, it has a little nipple on it. See that? So that'll go in this hole, and then these holes right here is where that nipple's gonna fit in, okay? So when we put these on, we wanna check them to make sure that they're on, okay? Okay? And that's put together as far as we need it. Now, when we count this to make it easy, we'll just count it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
So wing nut is a piece.
Yes, because it can come off.
Got it. Yep.
Okay?
Anything that comes
That's
up.
what I was gonna ask when you guys were
Anything
messing
that
with
comes
that.
off.
And also, like, this is this type of Balfour. There's also different types of Balfour out there.
Yes.
So when you guys go out there, it depends on what you see. Like,
Yeah,
your
Sherry,
hospital, how many pieces?
ours only have 9. We only have one
6
bladder
pieces.
blade.
So,
So it just depends
how it's
on
assembled.
where you're at.
Yeah.
How often have you used the
So
Balfour?
those are 3 different bladder blades.
Yes, small, medium,
I
large,
used
yeah.
it like 2 weeks ago in
Oh.
a esophagectomy. So,
Okay.
yeah.
Okay.
So it just depends. It's really surgeon's preference. More of a, like, all the old school docs, they like to use Balfour. The newer ones, they
Yeah,
don't
they
really
don't.
use that.
No.
What are the newer ones used?
Like Alexis,
Alexis,
Bookwalter, Thompson Retractor. And
Bookwalter's the one that
The
attaches
hooks onto the
Yeah,
bed, right?
yeah,
Yeah.
Thompson does too.
Thompson too.
giant one.
When we have some surgeon, well, I have one surgeon I work with, he don't even use
Yeah.
a damn.
And some surgeons, yeah, and one of my surgeons, when they do AAAs, they like to use the Balfour, no, like middle chuck. They don't like the bladder part. They just
Like
like
that part.
literally this part to hold the bottom part, and then they put an OmniTrack retractor on top. So it just
Yeah.
depends on what you use. Yeah.
Okay.
Any questions, concerns?
All the time.
Okay. It's gonna be a lot, and I really, guys, focus on setup.
Yeah,
Like,
focus
really
on the setup.
procedure, anticipation, you'll hear the cues, you guys will do just fine. Just know the steps, but this part is the main.
What
Okay.
was the Doan alternative? What was it called again?
It's a scudder.
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 Yeah, it's on the
What is
count
this
sheet. I recommend you take a
This.
picture of the count sheet and
Yeah, they got-
study the instructions.
One straight and one curved.
Yeah,
Oh, okay.
And
And
then
it kind of looks like a Dorian, so all
Yeah.
these bow clamps look the same.
yeah.
achromatic scutters.
Yeah, it's just that,
where
you
did
know,
I
the
put it?
Dorian has that one down the middle, this one
Yeah.
doesn't.
Yeah.
It's smoother.
Oh, I see.
Oh,
Okay.
okay.
Also the irrigation, you said small or large?
Okay,
Yeah.
so when you say small or big irrigation,
Yeah,
this is small irrigation, this whole thing is big irrigation.
Thank you. That's what I was
And
gonna
the other thing
ask.
that I forgot to mention too, when we're irrigating, do you guys know what we're checking for?
To make sure it's not like
Once we're done, once we're
Once
irrigating,
we're done with like the anastomosis, what are we checking for? We're checking for 2 things.
any holes.
Leaks.
Leaks,
Yeah.
Sleep.
anastomotic leak,
yep, air bubbles, yep,
air
because that means we
bubbles,
got a leak somewhere.
anastomotic leak,
Air
or
bubbles
bleeding.
and
Those
Okay.
are the 2 things that and that's why normally every case we irrigate
Yeah.
right before we close, because we wanna make sure there's no little tiny bleeders that we need to zap.
Okay.
Then when we're pouring the saline at the beginning, is it the same thing?
Same
Everything.
We
way.
say
Yeah.
this is warm, 0%.
Yes. This
Yeah.
is, yep, 0.9% sodium chloride, room temperature or warm, whatever.
Yeah.
Yep.
Do we need to fill the syringe up too?
Yeah, both of those
Everything.
should be filled
Yeah.
up.
Okay.
It's just sometimes they might ask for a couple squirts and you just give them this, but
Okay.
then that's why
Yeah.
we ask, do you want big irrigation or small?
Yeah. Sometimes they don't need to use the whole irrigation.
Yeah, sometimes they don't.
Yeah. Good? All right. You guys can break into your groups, and then